It is about 4 in the afternoon, and you are taking your shoe off. Not because you are going to bed, because it stopped fitting somewhere around lunchtime. And there it is, that ring around your ankle where the sock was. A groove pressed into the skin like someone drew it there with a pencil. Press your thumb into the front of your shin, just above the ankle bone. Hold it for a second. When you lift your thumb, the dent stays. You watch it slowly fill back in. 15 seconds, 20. So you have started doing the small arithmetic that nobody talks about. You wear the wider shoes now. The good ones stay in the box. You stopped wearing the ring on the bad days. You plan the day around how long you will be standing, and you have started saying no to the things that involve standing. Your legs feel heavy by 3 o'clock. Not painful, heavy, like they belong to someone taller than you. And when you looked it up, you were told to drink more water, cut the salt, and take a vitamin. Nobody told you what the fluid actually is. Nobody told you where it came from. Nobody told you why it arrives in the afternoon and is gone by morning. Nobody told you why it is worse in one leg than the other, or why that difference is the single most important thing about it. Nobody told you which of the tablets in your own kitchen cupboard can cause this. And nobody told you which kind of swelling means elevate your legs tonight, and which kind means telephone someone today. Swelling is not a disease. Swelling is a message, and the message is different depending on which leg it is in. My name is Dr. Haruto Ishikawa. I am a physician. For 22 years I have practiced internal medicine and geriatrics, which means most of the people who sit down across from me are over 60. And in 22 years I have never once been able to answer the question, why are my ankles swollen, in the 4 minutes an appointment allows? So I am going to answer it properly, here, with the time it actually takes. I am not going to sell you a supplement. I do not have one. I am not going to tell you to stop taking anything you were prescribed. I have not examined you. I have not seen your notes, and any doctor who tells you otherwise through a screen is doing something I would not do. And I am not going to tell you this is simply what happens when you get older. That sentence has hidden more treatable illness in people your age than almost any other sentence in medicine. Here is where we are going. First, what the fluid is, and how it gets out of your blood vessels in the first place. Then the one muscle in your body that is supposed to pump it back up, and what changes about it after 60. Then the 4 organs that can cause this, and how each one leaves a different fingerprint. Then the medications. There is a very common blood pressure tablet that causes this in roughly 1 in 10 people who take it, and a great many of them have no idea it is the cause. And before any of that, because it matters more than any of it, the signs that mean you should stop watching this and telephone your doctor today. That part is next. I am putting this at the front, not the end. Most leg swelling in people over 60 is slow, in both legs, worse in the evening, and better by morning. That pattern is common, and it is usually the mechanical problem we will spend most of this video on. But there are patterns that are not that. Please listen to these. 1 leg, not 2. If one leg is noticeably bigger than the other, and it came on over hours or a day or two, especially with warmth, redness, or a deep ache in the calf, that needs to be assessed the same day. One of the causes of that pattern is a clot in a deep vein. Clots in the leg can travel. This is not a wait-and-see situation, and no amount of elevation fixes it. Swelling with breathlessness. If your legs are swelling and you are also short of breath, climbing stairs, or lying flat at night, or waking up needing to sit upright, those 2 symptoms together are a conversation to have quickly. The heart and the legs are on the same circuit. Swelling that arrives with a puffy face, particularly puffiness around the eyes in the morning. Legs swell downward because of gravity. When the face is involved too, that points somewhere different. Sudden swelling. Anything that appears over hours rather than weeks. Skin that is breaking down. Weeping, blistering, an open area, or skin that has gone hard, brown and leathery around the ankle. If any of those describe you, please stop here and make the call. The rest of this will still be here afterwards. Everyone else, let us talk about what is actually happening. Here is the thing almost nobody explains. The fluid in your ankle is not something that leaked in from outside. It came out of your own bloodstream, and it does that all day, every day, in everyone, including people with perfectly slim ankles. Your smallest blood vessels, the capillaries, are not sealed pipes. They are slightly porous by design. At the beginning of a capillary, pressure inside pushes a small amount of watery fluid out into the tissue. That is intentional. It is how oxygen and nutrients reach cells that no blood vessel touches directly. Then, at the far end of the capillary, most of that fluid gets pulled back in. It is pulled back by proteins in your blood, mainly one called albumin. Think of albumin as the sponge in your bloodstream. It holds water in the vessel. Whatever is left over is collected by a separate drainage network, the lymphatic system, and returned to the bloodstream further up. So at any moment, there is a small, quiet balance. A little pushed out, most pulled back, the remainder drained away. Swelling is simply that balance tipping. Only 4 things can tip it. 1. Pressure inside the vessel goes up, pushing more out. 2. The protein in the blood goes down, pulling less back. 3. The vessel becomes leakier than it should be. 4. The drainage system cannot keep up. Every cause we discuss is one of those 4. That is the whole framework. Hold on to it. Now, the part that explains why this begins after 60 for so many people. Blood in your leg veins has to travel upward against gravity to get back to your heart. When you are standing, that is a column of blood roughly a meter tall. Your heart is a pressure pump on the arterial side, but by the time blood reaches your ankle veins, most of that push is spent. So what moves it up? Your calf muscle. Every time you take a step, the muscles in your calf squeeze the deep veins running through them and force blood upward, like squeezing a tube of toothpaste. Physiologists sometimes call the calf the second heart, and that is not poetry. In the standing position, it is doing genuine pumping work. To stop that blood sliding straight back down between steps, your leg veins contain one-way valves, small flaps. Blood goes up through them, and they close behind it. 2 things happen with time. The valves wear. After decades of standing, these valve flaps can thicken and stop closing completely. When a valve no longer seals, blood slips backward and pools in the vein below it. Pressure in that vein rises. And remember cause number 1 on our list. Pressure up means more fluid pushed out into the tissue. This is called chronic venous insufficiency, and it is extremely common. It is also why the swelling is worst at the ankle, lowest in the column, where the pressure is highest. And the pump slows down, not because of age itself, but because of what tends to change with age. Fewer steps, more sitting. A knee or a hip that makes walking uncomfortable, so you walk less, so the pump runs less. Ankle movement becomes stiffer, and the pump depends on ankle movement. This is the pattern that fits most people. Both legs, worse by evening, better by morning. It is better in the morning because you spent the night horizontal, and horizontal is the one position where gravity is not fighting you. If your swelling behaves like that, up in the evening, gone by morning, both sides, then the mechanics of this section are the likeliest explanation. 4 organs can produce leg swelling, and each leaves a different fingerprint. The heart. If the right side of the heart is not emptying as well as it should, pressure backs up through the veins, all the way to your ankles. That raises vein pressure everywhere, so this swelling is usually in both legs, and it climbs over time. Ankles first, then shins, sometimes higher. The tell is that it rarely travels alone. Breathlessness on exertion, needing extra pillows at night, waking short of breath, unexplained weight gain over days rather than months. Legs plus breathing is a combination worth acting on. The kidneys. Kidneys manage the salt and water in your body. If they are holding on to sodium, they hold water with it, and the extra volume raises pressure in every vessel. Kidney-related swelling is more likely to involve the face, especially around the eyes on waking. Kidneys also handle protein. If protein is being lost into the urine, blood albumin falls. That is cause number 2, less sponge, less pullback. One thing to look for is urine that appears persistently foamy or frothy. That is worth mentioning to your doctor. The liver. Albumin is manufactured in the liver. If the liver is not producing enough, the sponge weakens. Liver-related swelling often comes with fluid in the abdomen as well. The thyroid. An underactive thyroid can cause a distinct kind of puffiness that does not pit. Press your thumb in and the dent does not stay. It often comes with fatigue, cold intolerance, and dry skin. I am not telling you which of these you have. I cannot, and anyone who claims to from a video is not being straight with you. What I am telling you is that these have different fingerprints, and the fingerprint is the useful thing to bring to your appointment. Now the part I most want you to hear, because it is the one most often missed. A number of extremely common medications cause leg swelling as a side effect, not because anything went wrong, not because anyone made a mistake, because it is a known, expected, dose-related effect of how the drug works. The clearest example is a family of blood pressure medications called calcium channel blockers. Amlodipine is the one most people are taking. It works partly by relaxing small arteries, which lowers blood pressure, which is the point. But relaxing those arteries also raises the pressure inside the capillary bed downstream. Cause number 1 again. More fluid pushed out. Ankles swell. This is well documented. It is dose-related, more common at higher doses, and a great many people taking it have no idea their tablet is connected to their ankles. Others associated with swelling include some anti-inflammatory painkillers, which make the kidneys hold on to sodium, steroids, for the same reason, certain nerve pain medications, some diabetes medications, certain hormone treatments. Now hear this clearly because it is the most important sentence in this video. Do not stop taking any of them. Blood pressure medication is doing a job, usually protecting you from a stroke. The swelling is a side effect worth discussing. The stroke is not worth risking. Stopping a blood pressure tablet on your own is genuinely dangerous, and I will not be the reason anyone does it. What you do instead is bring it up. There are often alternatives within the same class, or different classes entirely, or a dose adjustment, or a second medication that offsets it. Those are all real options, and they are all your doctor's decision to make with you, with your notes in front of them. The only thing you need to do is raise it. Most people never do, because nobody told them the two things were connected. Now, what genuinely helps? These are habits, not treatments. None of this replaces working out the cause. Get your legs above your heart, not on a footstool, on the sofa, lying down, feet propped on cushions higher than your chest. 20 to 30 minutes, once or twice a day. Gravity did this to you. Use gravity to undo it. Use the pump, ankle circles. Point the toes, pull them back. 20 of each several times a day, especially if you have been sitting. If you are sitting for a long stretch, a car, a plane, an afternoon in a chair, do them every half hour and walk. Walking is the pump. Do not stand still for long periods. Standing still is worse than walking and worse than sitting. If your day involves standing in one spot, shift your weight, rise onto your toes, keep the calf working. Look at sodium honestly, not the salt cellar. The bread, the tinned soup, the processed meat, the ready meals. That is where most of it is. Ask about compression. Compression stockings work, and they work well for the venous pattern we described. But they must be the correct pressure and correctly fitted, and they are not safe for everyone. If the arteries in your legs are narrowed, compression can do harm. That is precisely why this is a question for your doctor and not a purchase from a shelf. Watch the pattern and write it down. One leg or two, morning or evening, better after a night's sleep or not. Any breathlessness. That written record is worth more in an appointment than anything else you could bring. So let us make the next 10 minutes of your life useful. Write these down and take them with you. 1. Which of my medications could be contributing to this swelling? 2. Is this coming from my veins, or should we be checking my heart and kidneys? 3. Should I have a blood test for kidney function and albumin? 4. Are compression stockings safe for me, and do I need my circulation checked first? 5. What change should make me telephone you, rather than wait for the next appointment? That last one matters most. It converts you from someone waiting and worrying into someone with a defined line. And I will say the honest part out loud, because I would rather you heard it from me. We do not fully understand why two people of the same age, with the same blood pressure and the same tablet, will have completely different ankles. Some of this is individual in ways medicine has not yet mapped. But we understand the mechanism well, and you now understand it too, which means the next appointment you sit in will be a different conversation from the last one. Your ankles are not a cosmetic problem, and they are not simply what age looks like. They are information. Ask your own doctor about this one. Bring the question with you.